Hello, and welcome to our presentation Behind the Scenes of Public Health and Physiotherapy by Caitlin Burton and Amanda Leo. The application of research is essential in order to provide effective evidence-based care to clients. The field of physiotherapy and the field of public health each require research in their respective ways in order to effectively and competently practice. However, each field uses research primarily in different ways.
In order to provide the most effective care, healthcare professionals must work together as part of a healthcare team. This allows healthcare professionals to specialize in their area of expertise while working with one another in order to create the highest level of care for an individual or population.
The goal of public health is to strengthen public capacity to protect and promote health.
Whereas physiotherapists use holistic care techniques to improve the health of patients suffering injury, therefore they act as post-public health intervention.
Evidence-based practice is essential in order for both physiotherapists and public health professionals to provide optimal care to their clients. One example in which public health professionals and physiotherapists both benefit from the same research findings is considering the research behind the Canadian Physical Activity Guidelines. Research shows that exercise improves mental, physical, and emotional health. Health Canada and the Canadian Society for Exercise Physiology began developing guidelines around how much physical activity any given person needs to be healthy.
Caitlin, why don't you come to the gym with me?
Why?
Because the Canadian Physical Activity Guidelines say that we need to get 150 minutes each week of aerobic activity to be healthy. Come on!
All right.
But why did health professionals begin using these recommendations once they were developed? Well, because they worked. Why did they work? Because the research behind them ensured that they would provide the desired outcome.
For example, one of the biggest ever constant public health problems is tobacco use. Tobacco kills more than 5 million people in years and is the single most preventable cause of death. Through public health research and policy implementation, public health professionals have increased population protection when it comes to tobacco use. I held a summer position working with the Central East Tobacco Control Area Network, a public health initiative working towards tobacco policy. This campaign is called Bad Ways to Be Nice. This campaign targets young adults and is working towards convincing young adults to think twice before giving cigarettes to teens. Before this campaign could be implemented, research went into determining that social supply of cigarettes is a prevalent public health concern, what the best way to target young adult audiences is, and finally, after the campaign, research was conducted with the Ontario Tobacco Research Unit to determine the effectiveness of this campaign. Look for this pictured poster on campus in November, and remember, giving cigarettes to teens is a bad way to be nice.
Evidence-based practice is also an essential aspect in the work of physiotherapists in rehabilitation. The current population is aging, and there's not enough people in the generation behind the baby boomers to support them. As a result, the baby boomers are going to need to remain independent for longer. Exercise is a simple and effective solution. By abiding by the Canadian Physical Activity Guidelines, it has been shown that there is an increase in mental function and capacity as well as positive long-term physical adaptations.
Research is essential in order to develop evidence-based practice, implement policy change, improve, prevent, and promote the health of individuals. Thank you very much.